In my practice, I feel like men that are good candidate for penile implant are men that have failed more conservative treatments, such as oral medication, or that are unable to take oral medication or tolerate oral medication. I generally like to see if a patient has inability to obtain spontaneous erection that's reliable at least half the time. Men that have a desire for years of sexual activity are perfect candidates for this. Insurance commonly covers penile prosthesis. Vast majority of private commercial paying insurances cover. In addition, government insurances cover penile prosthesis. Penile prosthesis is covered through the Veteran Affairs. And so the lack of coverage of a penile implant is really not an issue we face in most settings. Two most common types of penile implants in the United States are a three-piece inflatable penile prosthesis or a semi-rigid, also known as a malleable penile prosthesis. The malleable device is operated just by bending upward and downward. An inflatable penile prosthesis is operated by squeezing a pump that's located in the scrotum that's concealed. Squeezing this pump transfers saline out of a reservoir that's also been implanted in a different location concealed. It transfers fluid out of that into cylinders that then become full of the saline. They also become rigid and firm and expand. When that's no longer needed, the button can be pushed, which allows a release valve to allow the fluid to transfer back out of the prosthesis into the reservoir. Implants are sized on most men's normal anatomy. So after anesthesia and the procedures being performed, we actually measure the internal length of the corporal body, and this determines the length of the device that's placed. That exact length then is used with an inflatable cylinders, and various extenders can be placed on this to tailor it to the exact proper length. Oftentimes I talk to patients preoperatively about the implant and about what they can expect with length based on various physical characteristics and on physical exam. The malleable device is operated just by bending upward and downward. An inflatable penile prosthesis is operated by squeezing a pump that's located in the scrotum that's concealed. Squeezing this pump transfers saline out of a reservoir that's also been implanted in a different location concealed. It transfers fluid out of that into cylinders that then become full of the saline. They also become rigid and firm and expand. When that's no longer needed, the button can be pushed, which allows a release valve to allow the fluid to transfer back out of the prosthesis into the reservoir. For men that have normal ejaculatory function and normal climax and sensation prior to the placement of a penile implant, this should be exactly the same afterwards. Penile implants do not affect penile sensation, they do not affect climax, and penile implants sometimes in certain patients that struggle to reach climax, by having a better erection and being able to have more quality intercourse, actually sometimes will improve men's ejaculation, or will actually improve men's climax. These are not negatively affected, and if they're present before, they should be present afterwards. Penile implants are completely concealed. In almost all situations, the reservoir is placed in a location that's non-visual and oftentimes not felt at all. The pump is completely concealed within the scrotum, and the cylinders are inside the corporal bodies of the penis. Therefore, on casual appearance, an implant cannot be seen. Penile implants are composed of a BioFlex proprietary material of silicone that provides durability and long-lasting results. Sterile saline is the solution that's used inside the implant. Placement of a penile prosthesis involves a general anesthesia. A catheter is then placed to help drain the bladder. A small opening is made in the upper part of the scrotum. A special type of retractor is then utilized. Small openings are made in each of the erectile bodies of the penis. Measurements are taken, and then this penile prosthesis is then able to be placed in each side separately after proper measurements are taken. It's then secured. A reservoir that contains the saline is then able to be concealed in a location behind the pubic bone. The tubing for the penile implant, along with the reservoir, are able to be connected with a pump that's in a location in the scrotum underneath the skin. These connections are then made, the incision is closed. We usually leave a special type of dressing and wrap to help with swelling. Oftentimes we'll leave a post-operative drain along with the catheter for around 48 hours. Recovery after penile prosthesis placement is roughly 4 to 6 weeks. Most patients are able to use their penile implant about 4 weeks after surgery, after they have a follow-up appointment to ensure everything is functional. Penile implants last on average around 10 years. Studies have shown durability in numerous implants past 8 years. In my personal practice, I've exchanged implants in patients that have been in place for even 15 to 20 years. A lot of the durability of the implant allows for this long time that they last. With anything, certain circumstances, use, and other things can limit the life of the implant. With anything, there are some implants that need to be exchanged sooner and do not last as long, but on average, I tell my patients about 10 years would be a good implant. Patient and partner satisfaction rates are exceptional with penile prosthesis placement. Overall, studies that have been validated show over a 90% patient and partner satisfaction. Risk of penile prosthesis surgery include pain, infection, need for revision surgery, poor cosmetic outcome, device dissatisfaction, device malfunction,